I'm Dr. Gable with Inspire Smiles, an aesthetic and reconstructive dentist in Solana Beach, and I would like to share with you how we treat patients who need dentistry for more than just one tooth. So single tooth dentistry does not necessarily require a lot of additional steps, but sometimes it does. Most times when it's more than just a single tooth, we do have to look at the whole system, which is the teeth, ligaments, muscles, the joint, and the airway. And to be able to study that, we use what's called dental articulator, which is this. It's an instrument that simulates the Byte, which is called occlusion in dentistry, and that shows us how the jaw works. So we're able to mimic all the movements of the jaw in normal bite position, also in the position that's in function, like when people chew, and also to see what happens at night when people fall asleep. So this is the only way. It's called kind of like a bite simulator as well. It's called dental articulator. So this is how we study the bite, and this is how we design our occlusal scheme or reconstructive scheme to be able to accurately represent, first of all, what's going on in our patients' mouths, and then if we need to design aesthetic reconstructive new design, we use this to be able to create something that looks good and it works and also lasts, and this is the only way to do that. So we start by using a face bow, so upper jaw. This is a model of the upper jaw of one of our patients. So upper jaw is connected to our skulls. That's probably not a surprise for most people. And that part does not move, yet it is located in three-dimensional space for different people in different planes. So we have to record the position of that upper jaw for a specific person in the three-dimensional space. So we use that. So what we use for that is what's called a face bow, which is this instrument. So that records, again, the position of the upper jaw in 3 dimensions, and it also records the position of the lower jaw as it relates to the upper jaw, and relates it according to the hinge axis of the joint, which is on both sides of right and left side by the ear. So there's actually like a movement around the hinge, sort of like a hinge of the lower jaw against the upper jaw. So this instrument records that, and it makes a specific relationship of the individual, and that's how we create an accurate representation of that outside the mouth. Okay, so the next step, so you saw the face bow, and this is the articulator. So the face bow has a removable fork, which you just saw. So I take that out, and there's also a special connector that attaches it to the articulator, which I just did, and then the model rests in that. So the model, we take a special record so we know where to put the upper model, and then we use this really cool plaster, so it's kind of fun. I can play with it. And so we use plaster to mount it, to connect it to the articulator. So that's what I'm going to do next. Okay, so we have the upper model mounted, so we need to give it some time to dry. So it is plaster, so it takes some time, like a stone. So it will dry, so I have to clean up the articulator because I keep everything nice and organized and really pretty. And I do a really great job. So most people, when they do this, they don't necessarily make it like as pretty, but I feel like, you have to do it right. You have to do a good job. And so I also, at Spirit Education, where I got a lot of my training, one of the mentors, Gary DeWood, in fact, that's his name. So he said the quality of your models really speaks of the quality of the work that you do. So I put a lot of effort into mounting them not only correctly, but also doing it well. So I trim the models well, I mount it pretty, so it's nice and clean and organized. And there's also another saying that I really like is, how you do anything is how you do everything. So just practicing doing everything with great precision and accuracy, and also doing it in a very organized, clean manner is just the way that I commit to doing all of my work at work and at home. So this is just the way that I do that. And then also during the day, well, we are busy with patients, so we are, seeing people. So usually you would ask, well, when do you do all this? Like you must have some extra days when you do it. So I do it on Sunday at 9 p.m. So that's what time it is right now. And this is what we do because it takes a lot of work, and also a lot of dentists. So most dentists don't invest in this level of performance, quality of training, education, and also doing this kind of work, because it does take a lot of time, and it takes a lot of time outside of seeing patients. So you have to give up your personal time. And I gladly invest my time into doing it right and doing it well, because that's what I'm committed to. Okay, so we have our upper model mounted, so it's still drying, so I have to give it some time. So to be efficient with time, because it is 9 p.m. on Sunday, what we do while this is being mounted, even if I do it some other time during the day, then what we would do next is we take the Byte registration records. So we actually take two. So we take one as our primary, and the second one is to verify, because we want to double check and make sure that it's correct. So the only way to do that is to take two and see if they match up. So the Byte registration record, it has Byte registration material, so it goes between the teeth. We align the jaw in the most seated position in the skull, and then we take the Byte. So just and to be able to do that, we use a surgical blade. So we do have to be a little careful with this, so we don't cut ourselves. And also this, even though I didn't really show you how I did that, it may look easy, but it's not easy. So in the beginning, when I started doing this a few years ago, it was taking me hours. I was crying in the office, it's messy, and I did it wrong a couple of times. It's also not good for your manicure, so that's why I keep my nails really short. And I just keep it natural, because I need to work. So my hands are for serving people, they're for work. And I don't worry about myself, because I give all of myself to taking care of patients. So next thing, we're going to trim the bites. So I have to do this. So I have to basically take away everything that's extra. So there is nothing there that might interfere with the two models, upper and lower, being positioned correctly, and they seat firmly and evenly into the bite. So that's really important. Okay, so the Byte records, they're ready, they're trimmed, so nice and thin. And then our upper model is dry now, so I can pour the lower, or I'm sorry, mount the lower. So then what we do for that is we accommodate for the thickness of the bite by raising what's called this incisal pin. So I raise it up a little bit. So I just measured this. This is about a little less than 2 millimeters. So I increased the height of this to accommodate for the bite. And then we'll have to turn it upside down like this. And then for the lower model, it mounts a little bit lower on the articulator. So to be able to accommodate for that and also create pretty mounting, like I said earlier, so we take something like this, which is a model, which is like it's kind of horseshoe shaped at first, or maybe like this. And then we use a special former like that, and we pour a base. And we use stone, so we pour some stone in here and then set the model in that, and then it comes out back nice and pretty like this. So now it's ready for mounting. Alright, so we have our upper model is mounted, and the lower model is mounted to that. It's upside down. I know it might not be noticeable, so I have to give it some time to dry and finish it. So why do we do all that? So we do all that to be able to, again, study what's in the mouth, outside the mouth, because the mouth is teeth, ligaments, muscles, and joint, and airway, all operating together as a system. So what do you do when you come to the dentist? Usually you come to the dentist, and then for the exam, you open your mouth, right? You open your mouth, and then we look at it. So, and then sometimes we ask you to bite down, but you mostly keep your mouth open. So when you open your mouth for the dental exam, then just think about that. So by just opening the mouth and us looking, are we able to properly diagnose and tell you exactly what happens when you chew and when you sleep. So no, you put the teeth together, right? So even if you put the teeth together in the dental chair, you recline back, or even if you set up so you only bite down, so it's only once. So that's only like a static, position of the jaws at a single point in time. So that is not enough data to be able to properly diagnose a condition of let's say grinding, headaches, TMJ problems, or advanced reconstructive needs. So if it's, again, like more than just one tooth, we have to see what the teeth do. So when we treat just one tooth, so we pretty much just estimate. It's not accurate at all. I know it might come as a surprise. It's not. So we just estimate. And usually, because we have, normally 28 teeth, so one tooth we can kind of like polish, adjust, and kind of make it work. So with more than just one tooth involved, we have to have accurate representation of what happens in the dynamic movement and function, so we can actually create restorations that look great and they work, because teeth are meant for working. So we want beautiful smiles. Of course, yes, aesthetics is important, but we want the teeth to work, and we also want them to work well. We want anything that we create as a restoration or restorations, if it's smile design, to actually last, and we want things not to break. And the only way to do that is to do this proper diagnosis and planning with incorporating all the dynamics of tooth movement and function, and taking into consideration, again, position of the jaw in 3 dimensions and how everything is related to the hinge axis of the joint. Just like you would not expect your cardiologist to just listen to your heart and tell you what's wrong and just do the surgery based on that. Like, that just obviously doesn't make sense. So in dentistry, it's like that too. So it is a very, very serious profession, and to be able to do things well, there is a system of how we diagnose and how we put things together to engineer the design that works and lasts. And things don't break down, they last, they look great, and they function well, and people are comfortable. And it's also not just, again, my education and training, what's called hope for the best. So you can't just hope and pray, they're both great things. Hoping is great and praying is amazing. But when we create restorations for your mouth, I hope that you would require a lot more than that from your dentist. You would want them to create something that is engineered correctly, it's diagnosed properly, and it's created to last. And it's not based on hope and prayer. It's based on science, clinical data, and actual representation of reality outside the mouth, so we can use all of that to give restorations, again, that are of a high quality.